And we also sought to get some responses from the various communities that we operate in. And so we have some vox pops that will be playing from the students and the community members as well. Right after that, we are going to delve into our panel discussion, where our panelists will delve into the topic menstrual health in Ghana, looking at bridging policy practice and then the poverty. Right after that, we'll take some Q&As and then we'll do a call to action, of course, some vote of thanks, and then we'll take our group photo and we'll be out of here. So without further ado, permit me to play the FAWE anthem, and then I'll call on our national coordinator, Mr. Richard Mwini, to give his opening remarks. Thank you. Thank you so much. We'll now move to our official remarks, which will be given by Mr. Richard Mwini. Just to give a brief about Mr. Richard Mwini, he is the National Coordinator for FAWE Ghana chapter, and his roles entails coordinating and supervising the development, implementation, monitoring, and evaluation of FAWE Ghana's programmatic, financial, and institutional plans in line with FAWE Ghana's agenda. He is a certified chartered accountant and a member of the Institute of Chartered Accountants Ghana. He also holds a Bachelor of Commerce degree from the University of Cape Coast, an MBA from the University of Professional Studies Accra, and several postgraduate certificates. Mr. Mwini has strong skills in advocacy, monitoring, media, community engagement, and facilitation. And he has also coordinated various projects over the past 10 years, including coordinating and facilitating community consultation to promote girl-child education in districts with least gender parity index in Ghana, adolescent sexual reproductive health and rights in schools and communities, gender-responsive pedagogy in schools and communities, facilitation selection of applicants for scholarship. Mr. Mwini is passionate and committed to social justice, social development work, gender advocacy, and networking for equality and equity. He is a promoter of the agenda of leave. He's the promoter of the agenda of leave no one behind. Mr. Mwini, if you are connected on the call, please take the floor. Thank you. Okay, sorry for the break. I think Mr. Mwini is having technical challenges, and so hopefully he will be able to reconnect and then he would give the opening remarks. So I would move on to our keynote address. I see that our speaker is already connected, but before I introduce her, let me just give a brief about who she is. Professor Mrs. Abigail Opoku-Mensah holds a PhD in psychology with specialization in industrial and organizational psychology from University of Ghana, Legon. She is an associate professor at the University of Professional Studies, Accra, UPSA, particularly Faculty of Management Studies, Business Administration. She's currently the acting administrator of the Ghana National Research Fund and has also worked at the University of Cape Coast over 20 years. She also has experience in teaching and academic research and has served on several boards and committees and actively participated in a number of external services within the university and beyond. Her research interests include workplace diversity and knowledge management, work-family conflicts, employees, work-family conflicts, and employees' work attitudes. She's also focused on employee efficiency and effectiveness and social issues in management. Professor Opoku-Mensah has written over 40 article publications and has presented numerous academic papers in conferences, both locally and internationally. She has received several awards and grants, both local and international. Prof is a member of the Ghana Psychology Council, FAWE Ghana, International Federation of University Women, and Work and Family Researchers Network in the USA. She has been a great advocate in implementing period poverty in Ghana, in eliminating period poverty in Ghana, and has done a number of presentations on this subject matter. Prof, if you are here, kindly take the floor, please. Thank you so much.
Hello. Thank you, Naomi. I hope you can hear me. If you can hear me, kindly let me know.
Yes,
Prof. Yeah, we can hear you.
Right. Right. As I am here, our dear advocates from this morning, our development partners. Terry, I can see a number of the youth who have joined us this morning. Passionate change maker. A very good morning to it is with great and that I join you today as the keynote speaker.
Hello, Prof. Please,
Hello.
We were having challenges hearing you, so if you could.
Yeah, there's a feedback.
So if you could start.
Okay.
Thank you. And please let's all mute so that we can hear her clearly. Thank you.
Is it better? Can you hear me? Is it better?
Yes, please. I can hear from, yeah.
Right. So I first of all wish to begin by commending FAWE Ghana for its continued leadership in championing the rights and the dignity of girls through policy advocacy, education, and strategic engagement. Thank you, FAWE Ghana. Also, permit me at this point to also extend my warm congratulations to His Excellency the President and Her Excellency the Vice President of the Republic of Ghana, the Honorable Minister of Education, and the Honorable Minister for Gender, Children, and Social Protection for their vision and commitment in rolling out the free sanitary pad distribution program earlier this year. We all remember somewhere in April. As we all know, it is a groundbreaking initiative that represents a bold step forward for all Ghanaian girls. And you know, this has been a long-standing battle, and for me today, I am very happy we have gotten there. Truly, this initiative is not just a response to a public health alone or education challenge alone. It is a symbol of national progress, a declaration that Ghana is ready to dismantle structural barriers and invest in the potential of every girl, regardless of where she lives. So if you live in the village, you are in the city, or the girl's economic background. Very important. This program reinforces our commitment under the Sustainable Development Goals, especially the SDG 4 on quality education and SDG 5 on gender equality. By ensuring that the girls continue their education, let's put it in a very simple way. The girls go to school throughout menstruation period. Nobody is left behind. The policy does more than just hand out pads. It builds self-esteem of our girls. One, it protects education. Two, it reaffirms that The needs of girls are important in our national planning. Today, as we all celebrate the Menstrual Hygiene Day under the theme, Parts, Policy and Progress, Advancing a Period-Friendly Ghana. I like the part that says, Advancing a Period-Friendly Ghana. Ladies and gentlemen, let us be clear, very clear, that menstrual hygiene is not just about cleanliness or access to products. It is a health care and a human rights issue, an educational equity issue, as well as economic empowerment issue. When a girl understands her menstrual cycle, she has access to safe, clean products, and can manage menstruation with dignity. She is less likely to miss school, suffer from infections, drop out of school, or internalize shame that so often surrounds menstruation. I just want to share just a simple case a friend shared with me. A professor friend of mine who once sat me down not too long ago and shared her personal experience with me. She told me that she nearly dropped out of school simply because she couldn't have access to sanitary pad. I couldn't believe it. She said her parents couldn't afford, and that her mother was cutting used clothes, which we call the amosin, for her to be used during her menstruation period. So constantly she was getting infections. Often she will soil herself. And you know, when you are in school and you're a lady, you soil yourself, you know the shame that comes with it, how your friends would tease you. She almost dropped out of school. It took one of her favorite teachers, whom she's forever grateful, who came into her life and said, I will provide you with sanitary pad every month. Today, I'm happy to say she's one of the renowned professors in one of our top universities in Ghana. If it hadn't been, she would have dropped out. Another typical example I want to share. A friend of mine also had to give out her house to a mother of 5 teenage girls who approached her and said they were homeless, a single mother. So she gave out her home to them to live. Within 5 months, they reported that there's a blockage in her sewage system. So, of course, my friend invited a plumber to... Millicent, that'll be great. Thank you, Millicent.
So tell me that.
Thank you, Millicent. Kindly mute yourself. So this friend of mine invited a plumber to come in to solve the problem. And to our surprise, we realized that the system was choked with an upon Thank you, Naomi. So we realized that it was the constant disposal of these used clothes that the ladies were flashing in the WC. So when we got to know, we came on board, few friends of mine, to support these ladies. And I'm happy to say that they have all grown up today and they are occupying very key positions and they are helping other young women. There are many of such cases around us. Now, to move the menstrual health agenda forward, ladies and gentlemen, we must build robust partnership between ministries, CSOs, private sector actors, our traditional leaders, the media, very important, international partners, even our families and communities must all come on board to break the taboo and, of course, to try and dispel the negative myths surrounding menstruation. Let us come together to ensure that no girl in Ghana is left behind because of her period. And I must say that we all share responsibility for this. FAWE Ghana's work is a shining example of what is possible when we leverage cross-sector collaboration to influence policy, build capacity, and change narratives. Let all of us envision a period-friendly Ghana where menstruation does not interrupt education, where no girl is forced to use unhygienic and unsafe materials, and where menstruation is recognized as a normal, healthy part of life and not a burden to be hidden in silence when you are in your menstruation period. Ladies and gentlemen, as we move forward, let us also begin to turn our attention to innovation in menstrual health management. Looking at the current trend today, innovation must be considered when discussing progress. How do we dispose of our sanitary pad? Both at home and our girls who are in school, how do we dispose them? For me, I think we should begin to also look at the disposal of this waste in order to protect, one, our own environment and our own health. One such innovation which I have come across is the flushable sanitary pad. It is a biodegradable, water-soluble solution that is designed to disintegrate safely after use. This will not only improve health outcomes when we use them, but also reduce environmental impact of disposable menstrual materials. I just want to conclude by saying that as we celebrate progress today, ladies and gentlemen, let us work together. It is a teamwork. Let's work towards a future where every girl, regardless of her background, can go to school, can stay in school, can also achieve her full potential, period or no period. Let us make period poverty a thing in the past in Ghana, and also have a country that delivers dignity, opportunity, and progress to every menstruating person. Let us rise, all of us, not just as advocates, no, but as architects of a Ghana where menstrual health is a national priority. It's very simple. When we empower our girls, when we support them, we empower our families. Naturally, automatically, we empower the communities and, of course, our dear nation. So I want to say that as we celebrate, we should all come together to make sure that we eliminate period poverty in Ghana. We are in the 21st century. FAWE Ghana, this is a wonderful platform you have created for all of us. I know there are going to be panel discussion. We are going to ask very important and places. That's why I want to say a very big thank you for the opportunity given me. And thank you all very much for your key attention. Thank you, Naomi.
Thank you so much. Thank you so much, Professor Abigail Opoku-Mensah, for such a profound keynote address. One thing you mentioned that struck me was the fact that we need to build robust partnership with the various ministries, our communities, the media, the health advocates, and every other stakeholder to ensure that we break the taboo and demystify the negative myths of period poverty. This is very, very profound, also because this is the work that FAWE does. And that is why we are even having this webinar in the first place, to ensure that we bring together the various stakeholders relevant to ensure that we are able to come up with innovative strategies or innovative ways to ensure that we have a period-friendly Ghana. Before I introduce our panelists, I mentioned earlier that we had collated some responses from our students and our community members, young girls in the various communities that we're operating. And so we're going to take those responses, and then I would come back to introduce our panelists.
There's another girl, just like me. She's a real go-getter.
Actually, I have access to sanitary pad, but in terms of the hygienic products, I don't get access to them when I need them, because in my school, for instance, there's nothing like water or soap for you to wash your hands after you're done changing your sanitary pad, and there are not enough washrooms for you to stand there and change your pads. Thank you.
I get access to sanitary pads, but they are very expensive in the market. But others do not even get. As a result, they have to use rags, which is unhygienic because some do not know how to wash them properly.
I don't have access to sanitary pad because the areas where they sell them are limited. And in cases like this, you have to go to town to be able to purchase it. In certain situations like this, we use socks, racks, or tissues.
I do have access to sanitary pads, but for the other hygiene products like the hand sanitizers and the tissues and other things that I need to support myself with, sometimes I don't have them with me. But for other girls, I'm sure other girls do not have access to sanitary pads because of how expensive they are.
Okay. Yeah, actually, I've ever missed school because of my period. It was because of the pain I was experiencing, the menstrual cramps. I couldn't write my class test that day because I had to visit the sick bay, so they will help me in managing my pain. Thank you.
Speaking of missing school or class because of my menstrual period, actually, I have never missed school or class because of my menstrual period. Not because it's not painful. It's painful, but I endure. But I know of a particular girl in my class who misses class every month because she bears a lot of pain. The pain is always too much that even when she comes to school, she's not able to sit and learn or even concentrate. I miss school every time I menstruate because the pain is too unbearable for me.
For you?
Sanitary products are not affordable. It actually depends on the price though, but the least you can get in the market is 25 cedis, which is really difficult to get 25 cedis in the market, yes.
Sanitary pads are very difficult to afford because they are very expensive. One can cost up to 25 or 30 cedis in the market.
Okay, to me, the sanitary pads are quite affordable because my dad also supports me every month with a sanitary pad, and that makes me feel comfortable and making me to feel like they are affordable.
Okay, to me, sanitary products are affordable because it depends on the particular sanitary products you want to use. We have soft care, then we have YAS, and in this case, we've realized that YAS is expensive as compared to soft care. So with you being there, it doesn't matter the kind of sanitary pad you use or the kind of products you are supposed to abide by, but you should just go for the cheap ones. In this case, we are not all the same. So according to me, I normally get the cheap ones, like it ranges from 15 cedis, and it depends on the particular shop you go, because the shop around us, they might increase the price due to the fact that they went to the market and bought it. But for you to go to the market, you might even get it cheaper than them selling it in the shops too.
Actually, the kind of support I need is that we should be educated on how to manage our menstruation and how to cope with the menstrual cramps you are always experiencing, and that hygienic products or facilities should be provided so that anytime a girl is in her period, she will not feel ashamed or embarrassed to come to class because of that. Thank you.
Okay, so the support we need as girls to manage our periods in school is one, the infrastructure. We really need wash infrastructure so that we can actually practice the things we've been taught on how to manage our periods. And secondly, we also need the provision of sanitary pads and other hygienic products like the sanitizers and tissues. And we also need to be educated because most girls don't actually have that, that idea on how to manage their menstrual period. So it's really necessary for them to come and educate girl child on how to manage their menstrual period.
I would like to say that the boys should be educated about how we feel when we are menstruating, the pain we go through, the discomfort, so they can stop the stigmatization.
Okay, so in this case, if the government can provide us with the necessary support, like providing our sanitary pads, soap, then other stuff, because not only sanitary pad we use to make ourselves clean, even the adolescents are supposed to be clean in the period of menstruation. So in case or when the government provide these kind of things like soap, then other stuff, and in fact water is the important issue here. In a situation whereby you're in a school whereby you find it very difficult to like get water, it's not always good.
There's another girl, just like me. She's a real go-getter. There's another girl, just like me.
Right, we have had some responses from our various community members as well as the students, and we will definitely need to delve into the discussion right about now. But before I do that, I would like to introduce our panelists officially. So for Professor Gladys Abindaw Nabieu she holds a Doctor of Philosophy degree in Finance from the University of Ghana Business School. She also has a Master's of Science in International Banking and Finance from London Metropolitan University, United Kingdom, and the first degree in Bachelor of Commerce from the University of Cape Coast. She also holds a fellow certificate with the Association of Chartered Certified Accountants and is a member of the Institute of Chartered Accountants, Ghana. Professor Nabieu has also served as the head of department for the Banking and Finance Department, coordinator for the Masters of Business Administration in Accounting and Finance program, the hall tutor for the Yasantwa Hall of UPSA Hostel, a member of the academic board and faculty board member in UPSA. Dr. Nabieu has been the Vice President and Treasurer of the University Teachers Association of Ghana, UTAG, at UPSA. She has a cumulative experience of over 16 years in academia at the Business School of the Ghana Institute of Management and Public Administration, GIMPA, and the University of Professional Studies, Accra. As a senior lecturer, she has led various committees to develop 5 academic programs and 2 technical policies successfully. She has 12 scholarly publications to her credit. And before joining academia, she had 5 years of experience in various middle-level practice positions at private Yeah, thank you so much, Prof, for joining us today. I would move on to our second guest, or panelist, who is a sexual health and reproductive specialist and youth development champion with over 10 years experience in activism and programming for adolescent and youth reproductive health, HIV, maternal health, family planning, gender equality, and meaningful youth engagement. She also has experience working on social and behavior change communication, media advocacy, and project management. Esinam has worked and volunteered with several organizations, including the UNFPA Ghana, where she was a Youth Leaders Fellow. Her work in gender equality and sexual health and reproductive health advocacy has earned her opportunities to represent women and youth voices on several national and international platforms, such as UN Commission on Population and Development, convened by UNFPA headquarters and the United Nations General Assembly. Esinam is a 2018 Women Deliver Young Leader, 2017 European Development Days Young Leader, and a Youth Trailblazer awardee of the International Conference on Population and Development. She is the founder of Mind Teen Life, a grassroots initiative that provides reproductive health, including menstrual health education and services to adolescents and young women in rural communities in Ghana. Thank you so much, Esinam, for joining us today. I would move on to our last but not the least panelist. Ms. Josephine Adatsi is a first-class graduate of Pentecost University, holding a Bachelor's of Arts in Communication Studies. She is a passionate advocate for youth and women's empowerment, inclusion, and sustainability, currently serving as head of the Gender Working Group at the Alice Talk World and as a member of the Gender Working Group at the All Africa Students Union, AASU. She also interns as communications manager with Students Organizing for Sustainability International. Josephine recently spoke at the African Digital Summit, addressing over 25,000 attendees on women, leadership, and personal branding. With over 5 years of experience in student leadership, activism, and volunteerism, she has held roles such as SRC Public Relations Officer, Research Head, and a Notes Committee member. She has interned with the Ghana Investment Fund for Electronic Communication, GIFED, worked at Pentecost University's Quality Assurance Unit, and is a mentee in the More Women Leading program by the Eve International Foundation. A climate change and social justice advocate, Josephine is passionate and committed to learning and leading positive change, one impactful step at a time. Thank you all so much for joining us today. Can you all hear me, please? Can you all hear me, please?
Okay, yeah. Now we can hear. I think earlier the settings wasn't helping.
That's okay. Prof, can you hear me, please? Professor Gladys. SNM. Okay.
Yeah, hello, I can hear now. The host wasn't allowing us to unmute. I think it's better.
Sorry.
Yeah.
Yeah, sorry. So I believe you all can hear me now.
Yes.
Okay. So let's just delve into the discussion. Today we know that we are exploring the intersection of menstrual hygiene and health, policy implementation, sustainable funding, and some grassroots realities. So I'm going to start with you, Josephine. As a member of the Gender Working Group, I believe that All African Students Union, you've been conducting some form of research. And you have also heard about the free sanitary pad distribution program, which was launched by the government of Ghana some weeks ago. From your position, how would you assess the impacts of this program on school attendance and retention among girls?
Thank you so much, Ms. Naomi, for the opportunity. It's such an absolute honor to be here with you all to speak about such crucial and important issues that affect us young ladies. I would like to stand on all existing protocols that have been duly established and begin with that. So as a member of the gender advocacy group at the All African Students, we are very passionate about advocating, championing for the rights of young girls. And we are particularly honored and very happy for such a bold and commendable initiative that has been put together by the current government. We want to commend His Excellency John Dramani Mahama, our first Vice President, first female ever, the Minister of Education, the Gender Minister as well, and the entire team for putting this together. Putting together the free sanitary pad distribution program is one that we are very happy that has been put together, because as we prepared for this, according to a report by UNESCO, it can be seen that 1 out of 10 young girls in sub-Saharan Africa are absent in schools due to certain menstrual-related problems because of all these things. So it's very important, and particularly in Ghana, we could see with a report from Days for Girls Ghana, it could be seen that when young girls have access to menstrual products, whether free or subsidized, we could see an improvement. So this program is a one that we are commending and we are very happy. However, it should be implemented well with consistent, making sure that these parts that are going to be distributed should be on equitable. Can you hear me? Yes. Okay.
Yes, we can.
Yes, please. So these, in as much as we are commending them, we are also going to encourage them and let them know that it should be on equitable lines. In as much as we know by research that most of the girls in the rural areas find issues accessing these menstrual products. Some of the girls here in the urban areas too also face some of these problems. So finding the equitable grounds to make sure that each and every young Ghanaian girl can have access to these products during this program would be very important. Once again, we say Aiko to the government, and we say thank you. We say thank you to them for putting such a great initiative. Miss Naomi?
Thank you so much, Josephine. Yes, yeah, I can hear you. I can hear you. Okay, so before I move on to my next question, if you have any questions that you would want to ask based on Josephine's submission or any of the panelists that may come up, you can put them in the chat box and then we will take them one after the other when we are done taking all of the submissions. Now, I'm going to move to you, SNM. You are a sexual and reproductive health activist. So you do a lot of grassroots advocacy, community engagement. As someone on the front lines, what are some of the biggest myths and stigmas that you have encountered in the communities around or surrounding menstruation period? Of course, we heard the voices which were played few minutes ago, and we heard some of the responses from the students and also the parents. You as a frontline advocate, what are some of the myths and stigmas that you have encountered in the communities around menstruation?
Thank you so much, Naomi, and good morning once again. Good morning to everyone who has joined, and also standing on all existing protocols and Prof and all the others. So thank you so much for the opportunity. I think I would also equally join the other or earlier speakers to commend our government and every stakeholder who has made it possible to see this joyous news that we all keep celebrating in terms of the progress we have seen with the Free Sanitary Pad initiative. And if you are someone who has been in the space and you have seen the advocacy, even for what I came to meet as a young woman and seen where we have got into, then you definitely get to appreciate that this is something that it really takes a lot of effort, commitment. And we have seen in the past that things like this are ones that really come with that intentional commitment. And that I'm sure that is why everyone seems to be very happy for the bold step, because it has been said. Anyways, back to my question, when you look at a lot of the myths and misconceptions that surround reproductive health, menstruation and all of that, we see that from time immemorial, a lot of these have stemmed out of our cultural and religious practices. But most of the myths, when you hear and you want to ask for explanations that come with them, they all just align with, unfortunately, some cultural explanations that we get to hear from. From my personal experience, I'm sure some of us or most of us may have heard some of these that come around how periods are dirty. As a woman, you are dirty during the period. You cannot go to the kitchen. We have seen how women are not allowed to attend, or young wives are not allowed to attend to their husbands. They are not allowed to cook. Now, so these have all been a lot of the stigma that people or young girls get to face. And at the end of the day, the reason why we keep pushing and talking about it is that once it gets to affect the development of that girl, then it is not something that is right. And if because of something that as biological as menstruation, you are preventing a girl from going to school. There was one that I think came into the limelight about 4 years ago, and I hope that with the advocacy or with the issues that came when that story broke out, there has been some progress after that. So 4 years, I don't know, maybe some of us may have heard it. A story broke from somewhere in the central region, and just like 4 years ago, where girls could not go to school during their menstruation, because apparently in one community where girls were, there was no school, right? Now, the next community where they can access education, they need to cross a river. Now, it is a taboo that when you are menstruating, you cannot cross the river when you are menstruating. You don't need to, we are not walking in the water, you are walking over a bridge. But the taboo is that the river goddess, you are dirty, so you cannot cross that river when you are menstruating. So automatically, for a number of days, for every adolescent girl, unless you want to lie and say that you are not menstruate, and your parents will come back and ask you, didn't you menstruate this month, right? So it broke out, and then I was like, really? That was like just 4 years ago. So some of them are just really around how dirty that our culture has or religion has portrayed menstruation, something that is biological. However, I think that we have seen a lot of progress, right? Stigma still persists, no two ways about that. People are still learning, unlearning, and all of that. But we have made tremendous efforts in trying to demystifying a lot of these myths and misconceptions. So with that progress, I think that there's more to be done, but we all, once as we can, and we get into the space, we'll get the communication.
Thank you so much, Esinam. I think this story you were talking about is actually, it tells you the kind of, or it gives you an idea of how period poverty can affect education, a girl's child education, or her access to education even. Some of the students that we heard from the voices that we played, some of them mentioned that they couldn't attend school because they didn't have access to sanitary products and all of that. So I think the experience that you shared, or even the story that you mentioned, actually really tells you that, yes, there's been some progress in terms of now we have a policy which has been launched by government, but some of these things were actually still there even after 4 years. And that is actually, it tells you that there's a lot of work that needs to be done. I'd wanted to go to Professor Gladys, but I want to come back to you, Josephine, from your academic research and then your experience working with these young girls, being a gender advocate. How do you think menstrual health management intersects with gender equity and educational outcomes in Ghana?
Thank you so much, Ms. Naomi, for that question. So I've had my academic journey throughout, and also with my gender advocacy initiatives and projects that I've embarked on, it can be seen that menstrual health is not only about keeping clean or being dirty. It is more of a human rights and gender equity issue. Because if these young girls don't have access to affordable menstrual products, or even when they go to school, they don't have access to water, toilets, and privacy, it tells them something. It's trying to say that education was not designed with girls in mind, and that is infringing on their rights. So it is very important. And even as I was preparing, I came across a report with by WaterAid Ghana. It says that only 36 of schools have adequate WASH. WASH is the abbreviation for water, sanitation, and hygiene facilities. So imagine you're already battling with stigma and the silence around menstruation, and now you don't even have access to these basic amenities. It would later lead to you dropping out, as our keynote speaker said in the address, that one of her friends had to drop out. So it is very important. So when you put menstrual health here, it will mirror to the rights that we are trying to put across. So it shouldn't be like it is a girl issue, it is everybody's issue. So we should make sure that all these things are put in place, putting together all these enabling factors to make sure that girls can go to school. And when that happens, you'd see improved academic performance, leadership, and ultimately would have a more equal gender Ghana. So I think when we push for menstrual hygiene, menstrual advocacy, we are pushing for their rights. And that is how come the intersection comes in together.
Thank you so much, Josephine. Now to you, Prof. Nabieu. Josephine earlier commended the government for this initiative as well as Esinam. But you, from the finance point of view, do you think Ghana's current financing model for the menstrual health intervention, do you think it is sustainable?
Okay, thank you so much, Naomi. Also standing on the protocol observed so far and to make time for the discussion, I would just end it there. All distinguished members on platform and even the political agents who have put this together, I acknowledge that. Yes, so first of all, the program aligns with good broader initiatives, which are aimed at bridging the gender gap in Ghana. Okay. You know, the gender gap has so many problems, and this is one of them. But reading around, there are still some issues with the funding and implementation. When I try to read around the whole issue of the free sanitary pad initiatives, I came across some comments from some interested parties and, of course, some critics that draw our attention to potential logistic challenges, okay, including the sustainable financing of this program and even also the distribution methods, okay. For instance, one educational policy analyst said that the intention is admirable, but the execution is critical, okay. People are concerned, will it reach those who actually need it? In fact, my concern is not on that, but the greatest concern is on the financing it. You know, the government initiative on it, okay, for the secondary school is in the right direction in the first place. But I can bet you that the current funding model lacks some comprehensive and sustainable financing model. And this is likely to undermine its long-term sustainability, okay? In fact, I want to commend the government for having allocated about 292.4 million cedis in the 2025 public budget to provide for these free sanitary pads for all female students in their secondary cycle schools. But I see a lack of straightforward implementation and funding plan or strategy that will guarantee that this policy is going to be affordable, it's going to have an efficacy and efficiency, and also its sustainability. You know, in my opinion, the current model is woefully insufficient. Why am I saying this? You know, every year on the school enrollment increases. Yes. The data will tell us that it increases, and even that of female, because of these advocacies, it increases from year to year, which means that the budgetary allocation has to be done yearly to accommodate the increasing numbers. And this is public fund. Every community is rushing, or every department is rushing for this fund, I mean, small government revenue. So are we able to increase this next year to contain it? I'm saying this because if you compare some other good policies that were aimed under the previous government, government to kind of help rural areas generally, not even on only female. For instance, the one district, one factory initiative. I liked it so much because I felt like it was going to give a lot of employment to everyone. But what did we see? We heard of it. We didn't really see it. Now the government has assumed power so far. Have we heard anything about one village or one district, one factory? It's like it's dead. It was dead on arrival. I do not want to say I want to fear that this program can also follow the same trend. But from these advocacies we are doing, I am very sure that if we add our voice, we come together, let the government know, and even assist the government to talk about it, to find practicable ways of financing it, it is going to stand as a policy forever. And possibly it's not going to only benefit the second cycle. Once the financing model is good, it kicks off very well. You can be sure that even as we can go to any pharmacy, go to a district assembly and just pick a pad a month. I don't think that should be too much. So I think that stakeholders, to ensure the sustainability of this, all stakeholders, we have to consider investing into this, this initiative by assisting government in so many various ways to finance, which probably I'll outline later, to start it organically from the beginning. We start like building a factory. It can be through any other means to produce and supply. Then we can be sure of its consistency. Okay, so that whether with a budget allocation or not going forward, we'll be able to sustain it.
Thank you so much, Prof. Nabieu. This was a very comprehensive submission. Indeed, yes, like you mentioned, it's a very good initiative, but in terms of financing it to be more comprehensive and sustainable, there needs to be some strategies. You have mentioned some of the strategies, but I would want to move over to Esther now. You are an advocate and you tell stories. You tell the experiences of these young girls. How are you, or how are young people, especially the girls who are advocates, who are gender activists, how are we using storytelling and even advocacy to push for a more friendly Ghana? Yes, this is a commendable initiative. This is a commendable program by the government of Ghana. But how do we ensure that this program, even though it is commendable, we are telling the government that we want a more period-friendly Ghana? That is what we want to see in our various communities. SNL. Oh, okay. Sorry. Let me get. Okay, let me unmute you right away. Okay. I think you can do that. Okay.
Yeah. Sure. Thank you. I think that one of the key things, like Prof mentioned, and for every well-meaning person who is looking into whatever has been rolled out, those are the right tangents and the kind of questions that should be asking. The thing is, we seem to find ourselves at a crossroad at this point as a country. But for me, I feel like we are not the first to do this, right? So first of all, we should be at our own crossroads, but that should also now give us that perspective to look at what really works in our context. As someone who has a comms background as well as advocacy, and like you mentioned, storytelling has been one strong way of sending out the message about menstruation and all of that. If you followed closely during the time when activism grew on the Don't Tax My Pad campaign, you could see that it was one of the apex on issues around taxes, around menstruation and all of that. And at the time, yes, we still have, or we had pads being taxed as luxury goods, like really, and those were some of the frustrations that came. Parts were very expensive and all of that. So then there were calls, okay, local production. And like Prof mentioned, whilst you want to look at issues around local production, even at the time, some of the questions that came out at that time were also about, okay, if we want local production, do we really have capacity? Do we have capacity? Now, you are looking at capacity not just in terms of being able to produce to really meet your demands that you need on the scale for all girls. You are looking at quality and standardization. Do we,
Right.
the people who were producing, do they have that capacity to produce quality and all of that. I think when you play the video, one of the girls was talking about the fact that, oh, it's expensive, but then she goes for the one that is less expensive. You try the less expensive one, and some of them are very, very low quality. Some of the girls, one time, I think about 2 years ago, there was someone, like, I think the group meant good. During Menstrual Health day like this, and then they distributed some pads. Apparently, the pads were of low quality, and the head later called that a lot of the girls called that when they used the pads, they were having rashes and all of that. And now that became a second phase of issue that you now have to go back and address. And so you are looking at quality. A girl will be forced to go and buy a less affordable one because that is what she can afford, right? But it is of low quality. So we are at that crossroad that this is a very good initiative. But if we don't take care, like Prof said, in the next couple of years, we may come back and we cannot write a good story, or we cannot tell a good story in terms of what we have been able to do with this legacy policy, if we even want to call it that way. So we need to use, now we have a lot of platforms, media, right, from new media to traditional media. I always say, when we look at a lot of our traditional media space, how many? We have our media spaces waiting until special days like this before everybody is making noise about this. But we make some of these things just 2-minute segments on shows, 2 minutes daily stuff on morning shows and all of that. Today on demystifying menstruation, you just share a quote. We don't wait. When you wait, and then it is when everybody is making noise, we all make the noise and we all go back. And then it is left with the advocates to go back and still do the grassroots work or do the chunk of the work. But how do we all unburden this? Because we know media feeds people with information. What we put in the media is what people will listen to. When everybody started talking about don't tax my pad, when the media blew it up, people heard about it. And that is how we have used the media space has been able to help, at least for some time now, to get the conversation going. But how do we take it a step, a notch higher, or a step further, and ensure that a lot of people hear? And even with this, I am very concerned about how people are sharing the information. See, already information is going out to parents and they are saying government is giving free pads. A mother will just get up today and you'll be shocked that it is coming from a mother and say that government is giving you pad. Don't ask me for pad money. When the pads have not got into the school, when we have not produced the pads, so we need to be careful with how we are framing the information. The policy has been launched. The initiative has been launched. It has not been rolled out. Everybody says free government policy, whatever. And so parents already have it at the back of their minds that government is giving. No school has received pads. I think when this day was coming, a friend came to ask me that now that government is giving pads, that she have to put something together for girls in the schools that may be deprived or something. I said, madam, just go and do, because government has not started distribution and rolling out. The initiative was launched. They are still putting themselves together. So communication and language is very important as we roll this out and get communication out there to people. Else people will misinterpret communication or what the information they are hearing. And it might start creating problems than solving the main problem that we already wanted to solve.
Right. I think you mentioned something about the sanitary pads not being distributed, but it's only been launched. The policy or the program has only been launched, but as to the implementation, that has not been done. But I remember I saw a video of some SHS students saying that they have received the government's free sanitary pads. And I was wondering, are these the only students who have received it, or they probably received some donations from a specific NGO and they are already thinking that it is the government that has done that. So I think that there's the need for some form of education, because you even mentioned something about parents saying, okay, since the government is going to be giving out free sanitary pads, then I don't need to really invest. I don't really need to budget anything for my ward or my girl child. as she's going to school. But before I move on to the other panelists, since we are talking about the policy and you are a gender or a sexual and reproductive health advocate and an activist, what would a truly inclusive, youth-driven menstrual health policy look like from your perspective? Please. Okay.
Okay, thank you. I think that would be a lot of things coming together. A lot of times when I talk about stuff like this, I always say, just assume how you want to prepare your meal to look delicious, right? You are looking at having all the right ingredients in their right quantities and amounts to ensure that the meal you are preparing is what you want to eat and all of that. It's going to take different technicalities. Prof mentioned a lot of them. We are looking at issues around financing. We are looking at issues around sustainability. We are looking at issues around distribution, even the question of who gets it, who is leading. So right now, is it a full Ministry of Gender project or leadership thing, or is it a full Ministry of Education initiate like leadership stuff? We would have to map out all those parameters. We would need to do that intentional and real analysis of stakeholder leadership and know who is leading at what point. Because a lot of times, everybody is all over the place. And so you find out that maybe the gender ministry is working on something. It is not aligning with what the data the Ministry of Education has and all of that. Because if you want the number of students in schools, you go to Ministry of Education, right? If it's school, maybe those are just parameters. But I feel like, or from my point of view, for us to see this, we need to map out, like I said, all these indicators and align the roles so that it is more coordinated. Once we have this coordination well mapped out, we are going to see that everybody is playing their role efficiently and effectively. I'm sure that, yes, maybe I want to believe that as government has set aside the amount that Prof mentioned earlier, government, like people have started poking holes and asking about how sustainable is this financing. I'm sure that whoever is leading or the technical experts involved have started looking out for the next steps. And some of these things also should have a broader stakeholder consultation. So now, yes, I'm sure that stakeholders came together to lead. But as we are opening up now, who become the extended stakeholders that could be brought on board to see that as we are learning across as we are moving forward, there is that stakeholder engagement or broader stakeholder engagement so that we learn. We don't have it all mapped out. That is what I would say at this point. I just want to believe that everybody would look at it as a learning stage. And like I said, we are not the first. We have seen Kenya and some other African countries try this out. And so once we do the homework well and we look at where we should be looking and tell ourselves that we want this to really work, let's look beyond our personal beliefs and all of that. And like everybody is saying, menstrual health is a human right. The adolescent girl should not miss school because of her menstruation. Her education, access to education should not be interfered with by any way because of menstruation. If you see that for the greater good of the adolescent girl, I hope that we can all ask the right questions when possible, make the right contributions where possible, and ensure that the implementation rolls out smoothly even as we move. Just the last one, and maybe this is just a bit away from this particular question, but just in line with looking at how menstrual health and education and the other issues, even within the reproductive health sector, aligns and that if you do not address it. So for instance, I've always said that one challenge that a lot of adolescent girls face with their menstrual health issues around pain management and all. We talk a lot about stigma. A lot of times, adolescent girls don't have the right health information about how to manage their pain. One myth that it was a personal myth that I experienced myself, and I was told that if you have sex, it will take away your menstrual pain. There are people who spread that myth and misconception. Now ask yourself, how many teen pregnancies we may have recorded because an adolescent girl was told that this pain that you are facing because of your menstruation, if you have sex, and because she did not have the right information or anywhere to verify, she had unprotected sex and she got pregnant and became a teen mother. That is just for thought, because these are real life stories that we've encountered on the field. Someone said, I just had sex once, and not because even any boy lied to her, just because she wanted the pain to get away. Now she's a teen mother. That is just food for thought. So if you don't handle it from the top, it becomes the bigger, greater problem that we have to address at the base.
Okay, thank you so much, Esinam. I want Josephine, I don't know if you are here with us, but I wanted you to touch briefly, since we've talked about some of the interventions or some of the strategies on how to make this policy or program more comprehensive. What long-term policy solutions do you believe are needed to move from emergency interventions to sustainable menstrual health systems in schools? Because this initiative is kind of looking like is an immediate solution, is an emergency solution, but in terms of long term, we have highlighted, Prof. Gladys has already highlighted the financial model not being comprehensive and sustainable. From your point of view, what do you think are some of the strategies we can incorporate or we can come up with to ensure that this is not just an emergency solution, but it is more sustainable for others to benefit in the future?
Thank you so much, Ms. Naomi, for that question. It's very important as we are commending the program that has been implemented, distributing the free sanitary products across the second cycle institutions. The word we would want to look at here is longevity. Longevity and sustainability. How can we ensure that this is not just a one-time thing or a 2-year thing, but it can span across 5, 10, 15, 20 years. And one suggestion I would want to give is to implement a national menstrual health policy. Now, menstrual health policy. The program, the free distribution program, is a step, but we need to take it further, put together a policy that would be fully implemented and to be anchored on product accessibility. Product accessibility, as Sinam mentioned earlier, that we had the issue of don't touch my period, don't touch my pad issue. All these issues should be looked at in that policy, making sure that using a pad is not luxury, it is biological. It's something that is essential as a young woman to have. So some of those issues should be looked at, and that would all come under the National Menstrual Health Policy. Again, making sure that WASH standing for the water and sanitation and hygiene, to make sure that these young girls are having access to water to be able to clean themselves, hygienic conditions, so that they are not picking up infections and all that. That would also come under the National Menstrual Health Policy. Again, stigma reduction, come up with very and very practical ways of making sure that we can be able to alleviate, if not to completely take it away, because some people will still go through the stigma regardless of what happened, but to alleviate it, to make sure that that doesn't become a problem. So National Menstrual Health Policy should be really looked at. I would want to encourage the Ministry of Health, the Ministry of Health, very important, the Ministry of Women, and all the various stakeholders to come together to make sure that everybody has an input into the health policy to make sure that it is addressing our needs and concerns. Again, the investment in the local production, as said by Esinam as well, she mentioned that we are trying to invest in this local production, but sometimes some of the products are not of high quality and the quality sometimes become questionable. So if the quality is sometimes questionable, then we have to make sure we put in the right procedures, the right parameters to make sure that they are producing to the standards that can be used, that is of high quality. Because I believe that if we invest in our very own, we wouldn't have to be going out there to be seeking and to be importing all these products that would later become expensive, as these young girls in the video we watched earlier claim. So invest. And even when we do that, we are creating jobs, it's becoming, and Prof also spoke about we using the introduction of the biodegradable parts as well. When you flush it, it would also degrade and it doesn't cause the chokes. We can also look at that as a country. How can we produce such parts that wouldn't be too expensive, very affordable? So that we can look into the local production, but have very comprehensive parameters to make sure that that is happening. Again, data and monitoring. As doing all this, so we can now gather the data from this free distribution program and use that in monitoring and also like evaluating the impacts. We are sharing the parts. Are the children or the young girls receiving it? How are they using it? Is it addressing the concerns and the problems that we noticed and we are trying to curb or trying to navigate? So we need to make sure that all these proper monitoring and evaluating procedures to make sure that we are not just playing around and we are making sure that we are addressing these concerns. The district,
right.
Yeah.
Yeah, right. Thank you so much, Josephine, for your submission. Before I go back to, or I come back to you, Prof, I wanted you to talk about some of the ways that we can really ensure that menstrual health, like the menstrual national free sanitary pad distribution program, is more comprehensive, as Josephine and then Esinam have already talked about. But I'll come back to you. Before that, Esinam, can you tell us what monitoring and evaluation frameworks do you think should be put in place to ensure that the sanitary pads we are distributing are actually getting to the beneficiaries in a timely and also a consistent manner? Because I don't believe that, yes, this program has been launched. We are going to give students free sanitary pads, and we all know that we are in Ghana. And if we want to achieve period-friendly Ghana, we know that if a stakeholder or if someone takes the cost, or if someone even takes up the responsibility of production, another institution will probably take up the responsibility of doing the distribution. And how, I just want you to tell us, looking at the responses that you or the kind of conversations that you receive or you get yourself involved to when you go into these various communities, what are some of the M&E, monitoring and evaluation frameworks, that we should put in place, or the government should put in place, to ensure that the right beneficiaries are getting these sanitary pads and they are getting them on time and it's also consistent? Because we are talking about sustainability. And if we are not giving them on time, definitely that issue we are trying to solve will still be there. So what are the monitoring and evaluation frameworks you think we should put in place to ensure that these sanitary pads actually get to the people that we are trying to target or benefit from this initiative?
Okay, Naomi, thank you so much. I think that my opinion on this is going to be, first of all, that it's going to come from even before you have laid down rules or an M&E, how do you call it? Value scheme or anything that we want to use. First of all, it's going to be individuals, because
Okay.
at the end of the day, it's going to take an individual to hand it over at some point and all of that. But for me, I'm looking at how well we can, first of all, even simplify the distribution mode, first of all, to who it's supposed to get to. So yes, you have it. Okay, we have the ministries or the stakeholders who are overseeing or spearheading this. It's going to be a matter of from production to district level or district education. And I want to believe that by this time, all our district education offices have their numbers of their students on roll. They do have all those numbers. We at the regional level, it should be, we have regional coordinating councils, we have regional education services. So right from that top, how do we need to map out that distribution stream or that distribution thread to say that, okay, from the production side, it first has to, we need to deliver it to the regional level or maybe to national. Okay, fine. So national now has the data on regional statistics. Then that distribution goes there. Like you said, timeliness. So you need to give to ensure that this framework, M&E framework we are using, also includes one that gives the producers a timeline for production. The parts should not be produced and they're in the warehouses because there's no one to sign.
Yeah.
The parts should not get to national and then they are stored in a warehouse and there's no one to sign. They should not be at regional and cannot move to district because there's no fuel in the car. Because we cannot get a pickup that will send them to the school. Because the headmaster is not there to receive them. Because that's what those are the minute things that at the end of the day might cause the whole breakout in the system. It is a human institution.
Yeah.
It is humans that are going to lead this. So it's going to be on paper. And like Josephine mentioned, if we should have a policy, usually I've come not to trust policies, unfortunately for me, because we have so many of them sitting on shelves, implementation zero. And so I've come to be like, I am just nocturnal to issues around policies. But yes, a menstrual health policy would be a very good initiative that can help us to really hold government accountable and really streamline a lot of these things. So if we should have a policy, all these M&E framework will be in there. So it moves from one place to another. So that at the end of the day, we know that within the third week of the month, it has to go. Let's not forget that girls will not all menstruate in the third week, right? So girls will not all. So how do you ensure that the quantity that you are giving can be a quantity that at every point in time, a girl can have an excess part before her next consignment? How do you ensure that a girl will not really run out? Fine, even if she runs out, can we have a buffer in the school where she can go in and say to the teacher that, Madam, please, last month I had a heavy bleeding, a heavy flow, so I've run out. So she's entitled to have maybe one extra. You cannot say because you've given her two. If she comes at the end of the day, there isn't any extra for her. We should have that buffer somewhere with the head or the house mistress or something at that point. And so it's going to take human institutions, it's going to take some of these basic things that I've mentioned. Who distributes to what point? The cars that are supposed, okay, if the instruction is that the schools have to come to the district office and pick up, fine. The ministry should make sure that if it is transportation allowance they are making, we shouldn't hear of teachers saying that the district office is owing them arrears in transportation to go and pick up parts. It is as those small how do we call it, details that would either make this thing successful or really have issues to come back to the table to discuss. So like I mentioned early on in my previous submission, that it's a learning stage. We are all here, we are talking, broader stakeholders. So some of these things should be ensured. These things we can learn from other things that have already been implemented. How food is distributed, textbooks. Sometimes you go to the district level, and the books are in the warehouse. There is nobody to move it to even for many people who are concerned about it really reaching the person who needs it most in that far-to-reach community where a car goes there just twice a week, where girls have to walk miles. We need to be very intentional. Else, we might not get to that last mile in terms of distribution. There should be a deliberate effort to ensure that there is a last mile distribution so that every girl, wherever she is, at most, should be able to get it. I think I just saw a question. I don't know if it's a question or she mentioned that she's drawing attention. Yes, as at now, we know that out of school girls are not fat. They are saying government is saying they are starting with in-school girls. That is a very big risk that we might be taking there. And thank you for flagging that. We need to really pay attention to that. Because for all you know, if you want to do a needs assessment, the question is it in-school girls that really need it or out of school girls that really need it? We need to go back there. So yeah, thank you.
Thank you so much, Esinam. I really appreciate your submissions. We've talked about some of the mechanisms that you can put in place to ensure that this is very comprehensive. And yes, it's a challenge if you are hearing that this policy only addresses or attends to schoolgirls, girls in school. So it means that for those of the girls or for those young girls who are not in school, doesn't mean that they have to now find ways and means to get their sanitary pads. How are we making sure that the parents are well equipped or even financially stable to be able to afford these sanitary pads that we have? And in terms of production, we know that the locally made ones, we cannot really tell in terms of quality, whether it is matching up to the standards and quality of the ones that we import. So these are some of the questions that we can ask ourselves. And I like some of the ways that you've highlighted that we can actually make this program or policy a comprehensive one. But we all know that these things cannot be possible without money or without finance or without sustainable financing. I would like to come to you, Prof. Nabieu. What role do you think the ministries of finance, the ministries of finance and gender, education, and even the presidency, how do you think they can come up, they can collaborate to ensure that menstrual health and the hygiene is budgeted for as a core developmental issue? Because now we have identified this as a right and not necessarily like a privilege to be given sanitary products or to have access to sanitary products. How do you think these ministries can work together collaboratively to ensure that menstrual health is budgeted for as a core developmental issue?
Yes, okay, thank you so much. Yeah. So I think that mentioning only Ministry of Finance and Gender, they are not the only ministries. I think health too can directly come in to support or collaborate to spearhead this initiative. And as Esinam said, if it becomes a national policy, it will help. I don't really see problems with the distribution model. Like she rightly said, free feeding has been done. I mean, there are hitches here and there, but if you are able to, whatever policy you are rolling on, if you are able to achieve like 70, 80%, success, it's fine. Then we build on the hitches and then modify them. I think the greatest issue is coming from possibly the innovative financing mechanisms. To be honest with you, like I earlier said, a single financing source for any project or policy would always be a greater portion of the failure of that policy. Because what it means is that in the absence of that sole financing, then the policy is dead on arrival. Now, what I think that innovative financing mechanisms that should be in place to help should be multiples. There should be multiple sources of financing. Okay. And so Ghana can exploit several innovative financing mechanisms beyond just this tight traditional public budget allocation funding. Okay, so I think that we can look at a minimum of 5 sources of finance that can help this initiative strive. Okay, the first of all, I mean, it is not a new thing we are going into. Some companies are producing the parts now, in fact, of good quality. And that is how come the lady said they have the quality ones. We could contact such companies to come and partner with the government. And then we can leverage on this sector capacity to manufacture that quality standard that we are talking about. Apart from that, you know, Professor Abigail mentioned of the ESGs, that's the social, environmental and governance issues. Environmental, for instance, if you look at the WASH, that's the water and sanitation aspect of it, is another. In the past, if people use, whether they are rags, toilet roll, or whatever, how do they dispose of them? Which is another area that we have to look at going forward. So I think that if Ghana can adopt a public-private partnership with some of these companies to involve in producing, then we can distribute this affordable, quality, high, hygienic part to everybody. I mean, it can be an MAU to start with. Okay. In fact, when we say we involve all stakeholders with this initiative, I don't see any government going to ask for a land to mount a factory to produce this for the girls, and then they will resist. First, it's going to create employment for them. Now, government is even going to tax those who are going to be employed there and provide, you know, job opportunities for them, you know, and then we are going to reduce import taxes, which are also likely to affect our exchange rate. As you can see, just by the appreciation of the cedi, we see that exchange rates, debt, I mean, there's a lot of multiple advantages when we do that. So the first, as I mentioned, is the PPP, you know, financing source. Yeah. I think it's also important that government can look at issuing bonds, just gender bonds. It's specific to that, to this project. So when you issue the gender bonds, it can offer, it's another route that can allow government to raise capital enough to start our own production. Okay. Then there's this indirect, you know, way. We can talk about targeted levies on some luxurious goods. Now, the question is, how did GET Fund, for instance, came into being? How has it been sustainable? Even if not introducing something new as a levy on free sanitary pads, we can say once it's related to education, we can rely on the GET Fund, you know, levies, a percentage of maybe 0.02% increase from that place. That should come regularly from the goods and services that is done, directed to this project. I am sure within the next 2-3 years, once there are so many funding sources and you start the production, we'll go very far. Now, so apart from the PPP, government bonds, gender bonds, targeted levies, we can also leverage on corporate social responsibility. But I must say that, you know, companies, especially private, they can come in. But this might not be a very regular or fixed source of funding. You know, when they are able to sustain get the general public on one sector, they would like to move. So they can support, but it wouldn't be permanent. Now, diaspora contribution too can also be another main, you know, women-led groups from abroad, you know, contributing freely, you know, to achieve this initiative. So government can solicit for both permanent or temporal, you know, contributions from benefactors to support this initiative. I think that Prof also mentioned the issue of media, and I think media would cut across all this sector. Even in the funding advocacy, media will be very crucial in identifying both the funding sources and also to attract donors by, some people might not have even heard about it, even as we are discussing. But when they're able to blow it in the local languages, the international press releases, public, campaigns, the active role of public conversation in this through the media would increasingly the visibility of this project. And then I'm very sure that NGOs, developmental agencies will all come in to support. Okay. So I think that all ministries, including us, stakeholders, parents, can be involved. Now, just to add on, the question of those girls who are not in school, even I'm thinking we can go beyond girls out of school and even mothers. Like we said, in the district assembly is there, you go there, you can sign in for any woman. It's not, we all menstruate. So it's not only the school, but when we start to roll out with the school and it's successful, then we roll out to every woman. You can easily go to your district assembly, or they can even be deposited in, pharmacies for you to go, sign your name, or even if it is a biometric something to indicate that you've picked it, to go and then use your ID card to pick it for free. And would support women a lot.
Thank you so much, Prof. We are really grateful, and I really, really thank all of you panelists for coming on board to share these insights with us. I believe we've had a fruitful discussion. We are just about wrapping up, but I think I see Esinam's hand up. So maybe Esinam, you may have the floor to share your.
Yeah, I think when Prof was talking about the funding scope and something, I have mentioned that in another space about even looking. I think she mentioned that looking at the development agencies that already work on menstrual health. We have a lot of them that have main budgets that are supposed to target menstrual health, and they do stuff around parts and all of that. So if governments could really have that direct conversation with some of these with these international NGOs, then it could even be okay. So how do you invest maybe a part of your budget lines that's on reproductive health, commodities that go into menstrual health? How do you put some of this money into this fund that we are creating? And I think, like Prof said, some of these things you would think that when you bring it out to the public space, people might object or something. You might have a few people, but you'll be surprised at how much people appreciate, even if there has to be a national fund or something. I think a lot of what people would want to see at the end of the day is that accountability, that whatever they are putting or donating to is working. And that is why when people give donations and they come back and they see that you have evidence that whatever they donated was used for the right purpose, they would always want to give. But if somebody would give you and then we come and hear stories of how somebody took something or how monies were mismanaged, then nobody will be happy about it. So I think that was what came to mind.
Okay, thank you so much, Esinam. Before we wrap up, I just want to find out from all of you panelists, what commitments do you think we should walk away with? We have discussed the mechanisms and the strategies of making this policy comprehensive. We have talked about the financing models that we think would help this program or policy to be more sustainable. What commitment should we walk away with today? If we are to close this meeting, what are the commitments that you think we should walk away with? We are talking about government, we are looking at NGOs, even families. Tell us. Maybe I'll start with you, Josephine.
Thank you, Ms. Naomi. Thank you, Ms. Naomi. This issue is very essential. This discussion, this conversation, one commitment I would want to start with is that we should be very intentional about advocating for this. We shouldn't now go back into our various homes and institutions and forget about what we just discussed. We should be very intentional. We shouldn't wait till every May 28 to have these discussions. Let's be very intentional, follow up. And to our government, I believe if they can hear some of these very all-important suggestions that we have made and implement it, it would go a long way in achieving and making sure that all these young girls in school and out of school, because they are all citizens, they are all Ghanaians and have the rights to have this menstrual dignity, would also be able to have access to all these things. Various stakeholders, the finances, all they should make sure that all these things that we've put in place, I'm sure when they put it and implement it, we would get to where we want to get to. Those are my final words for now. It's been such an amazing time here having this discussion with our very learned and very all-important guest participant here. Yes.
Thank you so much. Thank you so much, Josephine. Prof, Gladys.
Yes, so I think the takeaways here would be for us to make conscious visits to these ministries, finance, gender, or if there's a forum we could sit together. And like Madam Esenam said, let them see the recommendations we have and we are bringing forward. How feasible can we get this done so we can help the long-term sustainability of this, project? Once we are able to roll it out successfully with the younger ones, then we can even extend it as a national, program. Now, beyond that, like I said earlier in my submission, it shouldn't be like one district, one village saga. If there's a national policy on it, we are the citizen and we have to, enjoy it. So once it is put in place, I mean, there shouldn't be any limit. This is something that's not like we are feeding on so that it's like I will take more than another. It comes once in a month. So if I walk to any pharmacy or any district assembly and say, oh, I need a pad, I should be able to sign for one and then feel free to go. I won't take two more. I mean, I shouldn't be giving two. I don't need it. Okay, so I think that we need to really sit with them. And then, broader stakeholder consultation would help because, going to the ministry that they are so busy with so many other things that, sitting down to really think through to find a sustainable way of, having this program is a problem. Thank you so much for the opportunity.
Prof. I would move to you right away, Esinam. You may have the floor.
Thank you, Naomi, and thanks to Prof and Josephine for their takeaways. I totally agree. And for me, I would just say that this is not the time to continue working in silos. We know ourselves. We are people like work. Everybody wants to show what they are doing. Everybody wants to do their own and be the first to announce it. But if there is one thing that we don't need in this time, maybe with this particular one, let's shield a bit away from deciding to work individually or in silos as organizations, as ministries, as individuals. Let's see how we can all rally together. And like Josephine mentioned, this is an all-important issue that we cannot let go. We have come too far to let ourselves down. It can only get better with whatever we are doing. And so for me, I would say that our takeaway is that we should all play our part. We should all commit. Let's hold government accountable. They have promised. Whilst we hold them accountable, let's also support them in any way possible. If there's any way that government is asking for some recommendations or something you can do, let's all support in our various capacities, in our various roles that we can. If there's a stakeholder engagement, let's not sit in our organizations and our offices and say it's government, they should do it. Let's support, let's give our contributions and see how it will go for the better good of the adolescent girl, of today's young woman, of today's mother and everybody. And thank you all so much. I've learned a lot from everybody, and such a pleasure to share this stage with Josephine and Prof. And thank you also.
Thank you all so much for such an insightful presentation. We've had a very fruitful conversation, and I believe that it will not just end here, like the commitments you shared. Josephine mentioned that we need to be very, very intentional about period poverty. We need to be very, very intentional about menstrual hygiene and health. Prof mentioned that we need to ensure that there's that recommendation. Whatever recommendation we have, we should have those recommendations shared for long-term sustainability, and also engage or ensure that there's stakeholder consultation. Whatever we are doing, we are not just, it's not just about what we think we should do. And I like your submission because it sort of like summarizes everything that we have shared, talking about collaboration, partnership. At the end of the day, we cannot work in silos. We need to collaborate. We need to come together to ensure that we are being intentional about menstrual health. We are sharing our recommendations, and all these things can be done through stakeholder engagement and collaboration. It's been an insightful discussion with you all, and I appreciate you all for making the time to join us this morning. We have our programs manager's hand raised, Madam Anna Nabieu. So you can take the floor, Madam Anna. Madam Anna. Okay, so I think there was maybe she's having some technical challenges, but I think I saw one question in the chat box, which was from Emmanuel Gazari, and he was asking, how do we achieve a dignified period for the marginalized, especially the persons with disabilities? I don't know which of the panelists would want to take this question, but you can unmute and then respond. Thank you. Madam Anna, are you ready to speak, please?
Yes, so I was struggling to unmute, but thankfully, I think you can hear me now.
Yes, we can.
All right, thank you very much for the opportunity. I want to make a contribution in line with what one of the panelists, I think SNM, said, that we have to do our homework well. Then I'll also be touching on the distribution, the financing, and then also a little on the monitoring. One of the speakers too equally mentioned that we can learn some lessons from other countries that took the lead in implementing a similar initiative, that is the free sanitary pad distribution. And I want us to take a clue as advocates, if we are able to pay attention to some of the challenges that our neighboring countries are facing, especially Kenya, that is implementing the free sanitary pads, and target our advocacy, we'll be able to ensure a successful and effective implementation of this commendable program. So in Kenya, for example, they had delayed supplies. So sanitary pads sometimes will arrive late, and then leaving the girls for the essence for which they've introduced the program. The girls will menstruate for about 4 to 5 days, stay away from school, and the sanitary pads will never be distributed to them to use. Somebody also mentioned about Ghana. You know, our free uniforms and then the free exercise books in secondary schools, which can delay for a year. So if we don't do our advocacy properly for timely distribution, which I think is very crucial, at the end, this program will be like a procurement activity, and then it will never materialize for the intended purpose. Talking about unreliable funding, in Ghana, the program is projected to cost about 294 million this year. And then they are allocating about a GET fund allocation of 25 million. That is, we can say that over 90% of the funding is expected to come from the government of Ghana, which all of us know is unpredictable and unreliable. So one advocacy area that we have to focus on is the reliable funding to ensure that this important program.
Thank you so much, Madam Anna.
Okay, so if I may come in with the question that was asked before she came in, if she's true, you know, it depends.
Do I still have the floor?
Okay.
Okay, we
Sorry.
thought you were done. Yeah, you can proceed, Madam Anna.
Yes, you know, when the students were talking, were giving their challenges, most of them talked about the infrastructural challenges. So in Ghana, for example, about 60% of the basic schools still lack suitable, they don't have single-sex toilets, including even in the urban areas. In Ghana here, in Accra, I think in one of the news, I heard Pantam Basic School, which is very close to Adenta, where we still have people using the bush for their whatever. When they want to ease themselves, they have to go to the bush. You can imagine girls in such schools. So the concerning the monitoring that somebody talked about, the weak monitoring, I want to add that under the school feeding program, we had similar challenges. But I think what we can do differently, or what we can advocate to ensure that this policy is effective, is that they should develop a digital inventory distribution system that allows for independent tracking of the sanitary parts within the supply chain. So the presenters talk about the different key people that are going to involve in the production, supply, and the distribution. You know that at the district level, most of the record keeping are manual. We still do manual record keeping. So if we can move away from that and then ensure we have a digital inventory distribution system, that will be helpful. For the distribution, and a lot has been said, so let me pause here and for others to contribute. I can see that we are running out of time, but from the conversation, we have to target our advocacy, looking at the challenges that other countries have faced, the delayed supplies, the unreliable funding, and then the way the parts are distributed, and even the weak monitoring and accountability system, even including the poor quality, and then advocate on the infrastructural development. Thank you very much.
Thank you very much, Madam Anna, for your submission. Very critical contribution to our conversation that we've been having since we started this meeting. I don't know if Prof. Gladys, you would want to come in.
Yes, so I wanted to try to address the question that was asked concerning how the marginalized are going to benefit from this free sanitary pads, distribution. If it comes into reality, I think that targeted menstrual education will help. Okay, we have different versions of types of disability. Maybe if it is a deaf person, a sign language will do. If it is something we have to do, a pictorial guide, to fly around the media, WhatsApps, so that, they can get to know about it. It helps. we use the trained teachers and caregivers. They can also help. Now, there is this issue of involve them, because nothing for them without them. You know that?
Yeah.
So they are able to even plan the way the interventions would work for them. So we can help them out, okay? And that issue of stigma will continue to hamper through the media, to try to get the marginalized, also accounted for. I mean, beyond everything, all the policy inclusion can also help for the disabled or the marginalized to benefit from every government policy, including this one that we are discussing about. So I think that would be the way to go. Thank you.
Thank you so much, Prof. Gladys, Nabieu. I think just when you had raised your hand, I don't know if you would want to make any submission before we close the meeting. Sorry, Josephine, kindly hold. Okay.
Thank you so much. I feel that question is very, very important. Well, it might have escaped it, but we thank the person who sent that question as well. As Prof has mentioned, all those strategies can be done. And one thing I would also want to add on to is that also introduce disability-friendly stations, especially when it comes to the water, and sanitation, hygiene facilities that we find in schools, in churches, wherever we find ourselves, all these socialization processes, areas that are disability friendly with our brothers and sisters who sometimes use the wheelchair, those who are using the walking sticks and all that. Those parameters should also be put in place to also address and make sure that they also have period dignity. That was what I wanted to say. Thank you so much.
Thank you so much, Josephine. And to you all our panelists and all of our participants for making this session a very interesting one. I do not see any questions in the chat box. I also do not see anyone having their hands raised. Okay, Emmanuel, you may have the floor now. Emmanuel.
Yes, I want to, it's not any contribution. I just want to recognize somebody from one of our districts who have joined.
Okay.
And she's playing a very key role. Esther Mbla is the adolescent focal person for Bongo district. And so when I was checking and I saw her name, I said, no, I will draw our attention so that we can appreciate her for joining. So beyond the students, we have one of our health workers in our midst. Thank you.
Thank you so much. And thank you to you for joining. So without further ado, I would like to call on our human resource manager, who is in the person of Vivian Kwam, to give some vote of thanks, and then we'll take a group photo. But before we take the group photo, I would want you to listen to a song which will definitely tell you a bit about FAWE Ghana, just in case you may have forgotten or you may not even know that it was FAWE Ghana that worked on the song. So Vivian, you may have the floor, and right after Vivian's submission, we would take the song and then we'll take a group photo and we'll wrap up. Thank you.
Very much. And you have to use every
Okay.
Thank you very much, Naomi, I'm back. Thank you. So on behalf of the FAWE team, I would like to thank our keynote speaker, Professor Abigail Opoku-Mensah. Thank you so much for the awesome delivery on the menstrual health. It was very insightful. I would also like to thank the panelists. In no specific order, I'll start with Professor Gladys, Abindaw, Nabieu, Madam Josephine, Worlali, Adatsi, and then Madam Esina Mamuzu. Thank you so much for the knowledge shared on this very important issue on menstrual health. Would also like to thank our stakeholders and then our partners who have joined us. Madam Esther from the Bongo District, thank you so much for joining us. And also to our board members, our students and the FAWE team and our national coordinator, thank you so much for your time. We really appreciate it. And we hope that together we can work to eliminate period poverty in Ghana. Thank you very much.
Thank you so much, Vivian Kwam, for the vote of thanks. As I mentioned earlier, please give me a few minutes and then listen to the song. Right after the song, we'll come back to take our group photo and then we'll disperse.
Mama, I wanna go to school. Papa, I wanna be in school. I wanna learn reading and writing, teacher. I wanna be in school. Mama, I do wanna be in school. Oh yeah. So Papa, let my dreams come true. Send your girl child to school. Send your girl child to school. Send your girl child to school. Mama send her to school. Papa send her to school. Send your girl child to school. I don't wanna be an illiterate. I don't wanna be a dropout girl. I wanna be a doctor, a teacher, and technician. Mama, I do wanna be in school. Oh yeah. So Papa, let my dreams come true. Send your girl child to school. Send your girl child to school. Send your girl child to school. Mama send her to school. Papa send her to school. Send your girl child to school. FAWE babia kosuku. FAWE babia kosuku. FAWE babia kosuku. Mama fane kosuku, Papa fane kosuku, FAWE babia kosuku. Let's hear it for the girls. Celebrate it for the girls. FAWE babia kosuku, FAWE babia kosuku, FAWE babia kosuku. Mama fane kosuku, Papa fane kosuku, FAWE babia kosuku. Yaramata suchesku, yaramata suchesku, yaramata suchesku. Una mucha Jesuku, Baba mu Jesuku, Yaramata su Jesku. Kelbio Aya School, Kelbio Aya School, Kelbio Aya School. Mama ha neya school, Papa ha neya school, Kelbio Aya School. Dovyo yana viade suku, dovyo yana viade suku, dovyo yana viade suku. Apeno do yana via suku, apeto do yana via suku, dovyo yana viade suku.
Great. I'm sure some of you, if not all of you, or most of you, do not know that it was FAWE Ghana that did the song long time ago. Yes, the song is really nice. Yes, we'll try and share the link to the song for you when we are sending out other further communications. But before we take our photo, I just want to give a special appreciation to all of you, especially to our keynote speaker, Professor Abigail Opoku-Mensah, for joining the session, to our amazing panelists, Josephine, Professor Gladys, Nabieu, Esenam, Amuzu. Thank you to our partner institutions that join us, all the lecturers and students from our partner institutions and every other institution that came on board. We are really, really grateful, ladies and gentlemen. It's been an amazing time having this fruitful conversation and discussion on menstrual health. And we hope to keep in touch by engaging more, scheduling some of these sessions with you to share more ideas. Of course, we mentioned or we highlighted today that collaboration is key, and some of these stakeholder engagement sessions would really, really help us to be able to serve our various communities better. And so we'll be calling on you more to engage with you and also share your ideas with us. Right after this call, we are going to, or this meeting, we will definitely receive some thank you notes, and then we'll share a survey link where you tell us how this whole event went about. So you're going to basically just give an evaluation of the session, and of course, it would help us or guide us on our subsequent engagements. I don't think I mentioned my name. My name is Naomi Dapon. I am the Communication and Advocacy Officer for FAWE Ghana, and I've been with the team for some time now. It's been awesome having you on board. Please quickly turn on your videos or your cameras so that we take a group photo before we log off. Please turn on your videos. Right. This is screenshots. Okay. Please turn on, yeah. Okay. Please keep it on. For the last time, we are going to take this and then we'll be out of here. Okay. Thank you all so much for making time. It's been an exciting moment with you all. We'll definitely share the link to the recording with you, as well as a survey link to evaluate the whole event. Have a wonderful, wonderful day, and we hope to connect with you some other time. Bye.